Wellness for Life is brought to you by Purim Physical Therapy, Gothenburg Chiropractic Clinic, Mojave Ottawa Community Action Partnership.
Hi, I'm David Gothenburg with Gothenburg Chiropractic here in Pelican Rapids, and the topic of discussion today is disc pain. And so I'm going to talk a little bit about how the disc is constructed and some of the pitfalls when we treat a disc. Before that, I'd like to mention that I've recently been certified with the Federal Motor Carriers Safety Administration, a big word, and that allows myself to conduct and provide DOT physicals. So if you're a truck driver, this is just another place that you can have that exam, and you can call our office at 218-863-2134. My topic today is what constitutes disc pain. Some people might hear the words slip disc or bulging disc, but first of all, it's important to understand how this disc is designed. So to begin with, you have these concentric rings of very, very tough fibers that surround a jelly-like center. Think of it almost like a miniature jelly donut between two vertebrae. A bulging disc is when the outer fibers, usually the largest portion of the disc, extends outside of its boundaries. This would almost be like thinking of a hamburger that's too large for the bun. Some say this is almost a normal part of aging. The second type is the word herniated, and this is where the outer fibers have torn, and now the contents, the nucleus, the jelly-like center, extends outside that boundary. This is often associated with back and leg pain, pain that may sometimes extend all the way down to the big toe, and it may even cause cramping or spasms in the buttock or lower leg. The next point that I'd like to make is that I want to assure you that chiropractors are well qualified to treat disc conditions. We have extensive training in radiology, in other words, to read an x-ray, and we have good, safe techniques and procedures that do work and will work with different types of disc injuries. It's a big subject, but I can tell you that we're well qualified to help people with low back and leg pain. One of the most common misconceptions when treating disc pain is the time required. When a chiropractor manipulates the spine, what we're doing is we're changing the position of the vertebrae either above or below, and not necessarily changing the position of the disc. So what we want to do by treating people, we want to create a good environment for that disc to heal. The things that really slow the recovery is, number one, I think, poor blood supply. A disc may heal or take longer than a bone injury. Other things that can have a direct impact on how a disc heals would be the weight, the person's posture, their history. And if they're still doing jobs like bending or twisting, or even if you have a job that you have to sit all day, that really lengthens the time that it takes to repair and heal. In closing, if you're aware that you have a disc condition, it really helps to bring an x-ray or, for that matter, an MRI report. I'm here in Pelican Rapids. We can take a look at any of the information you have and decide if it's something that we can help you get better with. Thanks for your time today.
Thank you for watching Wellness for Life. Brought to you by Purim Physical Therapy, Gothenburg Chiropractic Clinic, Mojave Ottawa Community Action Partnership.